I was diagnosed with COPD not so long back.
That's chronic obstructive pulmonary disorder, yes? A lung disease.
It is, yeah.
Yep.
And emphysema.
Okay.
And at the time, I'd said to the nurse who was testing me that I'd had some tests before but never had any results back. And when she's had a look, the doctor had diagnosed me but hadn't done anything about it. And the same doctor was, he had to be carried out of his car when the police caught him drunk driving on the way home from work. And he admitted that he used to drink doubles of vodka in between each patient. But he went up to the General Medical Council and he kept his job because they said that he posed no risk to patients. Well, I beg to differ.
Okay, Joe, can I ask you some questions?
Yeah, of course.
Right, so first of all, when were you told that you had COPD?
3 months ago.
3 months ago. And when did this doctor diagnose you with COPD but fail to tell you?
10 years ago.
Does it say in your notes that
It does.
It says COPD in your notes for 10 years ago?
It does.
Okay. Have you seen those notes, Joe, or have you just been told that?
No, I've just been told it. The lady who does the COPD, she's a professional COPD nurse, and I asked her to have a look, and she done a search for COPD in my records, and it came up,
Wow.
and it was doctor, and yeah.
Now, if you'd been diagnosed 10 years ago, would it have made a difference? Could you have been given treatment that would have helped? You don't know?
I mean, I have suffered over the last 10 years with continuous chest infections and that kind of thing. And obviously, I haven't been given any inhalers to help me when I have been struggling and that kind of thing.
Has your GP not seen this in your notes at any point, or was it a separate hospital record?
No. The GP that I was with, the one who was drunk at work, he closed his practice. And
Sorry, I assumed it was a hospital consultant who was drunk.
No.
So your GP diagnosed you. So your GP diagnosed you with COPD 10 years ago, but didn't tell you.
Yeah.
When did he leave the practice?
2017.
So that's 5 years ago, or just over. Mm-hmm. So was that when you got a new GP?
That's when we got moved over into another practice.
And did that new practice not notice it when they reviewed your notes and met you for the first time?
No.
Okay. So I think you do have a claim here for negligence.
Right.
Plainly, diagnosing you with something and not telling you about it is negligent. And that's just obvious. The fact that he may have made that mistake because he was drunk is almost a red herring. I understand why you feel aggrieved, Joe, but it's actually a red herring because the mere fact that he diagnosed but failed to tell you, that's enough to establish negligence. The cause of his negligence, that he might have been drunk, is as I say, a red herring. But normally you have to bring a claim for negligence within 3 years of the negligence happening. But there's an exception if you don't discover the relevant facts quickly. And the 3 years actually starts running from when you discover the relevant facts, which would have been 3 months ago. 3 months ago. So I would go to a firm of solicitors that specialises in medical negligence, because you do need solicitors for this. This isn't something you can do yourself. One of the things they'll investigate is whether it's made a difference, whether giving you a diagnosis and perhaps putting you on treatment would have made a difference. If it wouldn't have made any difference to your symptoms, there's not going to be any compensation there, if you would have been in the same position anyway. But if it would have made a difference, you'll be entitled to compensation, Joe.